Hey guys, thanks for tuning in Florida Drive-By, July 15th, 2016, Friday, 3:03 in the afternoon. It's a big old 100 degrees Fahrenheit out here. 100 degrees, guys, in Florida right now. And I hope everybody's doing pretty cool and doing good. Just want to break it up and say hello. Well, you know, I was listening to the news today, and they said they have the first ever case of the Zika virus being spread from a woman to a male. First ever. Interesting, huh? The Zika virus can spread. Of course, it's a virus, guys. It's a virus. Now, they said partner, so I don't know if they're talking about a woman, but it was spreading to the partner. I'm pretty sure it was a male. But you can see a lot of these viruses and things that, you know, we don't know a lot. You know, I knew a guy, he was a male nurse. He was a registered nurse, real intelligent guy. He got out of the nursing field, right, the medical field. He was doing a home health care because he got out of the regular nursing field, like working in the hospital, and he was working with a lot of AIDS patients. And even when he got out of it, they would send him to AIDS patients which are terminally ill or dying from the AIDS virus. And you don't hear much about AIDS right now. Still, you know, a lot of people dying from it, but you don't hear much about it. But he would tell me that you know, they don't tell you everything there is about the AIDS viruses, and they don't tell you everything about other you know, viruses and stuff that people get. So, you know, not all that information is given out. So a lot of people are getting these viruses, and you know, you don't know what it'll cause, what effects it'll have. So but you know, I wanted to bring that up, and so you got to be very careful. Some of these viruses are, you know, I mean, if they don't study them and they don't know much about them, and somebody gets them, you know, they're not going to know how they spread and stuff like that. And then there's another theory that a guy said, the reason we're getting and seeing more viruses now is because mankind has been around longer now. Diseases that used to, you know, wipe people out, you know, 40, when they were 40, now there's more diseases that come and they wipe people out at 60 or 100 or whatever. So now you're seeing viruses and, you know, parasites out there that, because it's just because people are living longer. So there's more chance that they're going to get infected with something. Overall, we have a very good medical system, and you know, there was also a case there before, and I guess this is a hodgepodge of viruses and infections I'm talking about. There was a doctor a long time ago who was talking about autism, and he was saying mercury or some of the chemicals used to process viruses, the vaccines, caused autism. And that was a big thing. People didn't even want to give people shots. You know, that parents didn't want to give their children shots, and they used to, well, they still do it. They would put silver iodide or a silver solution on your eyes to prevent disease and syphilis and stuff and all this other stuff. And people thought all this chemicals and stuff and everything they used caused autism. And that was a big deal because, you know, somebody said that, a doctor or something. So what happens later on, come to know, and I just heard this about, that was like a year ago, I was in my car. The guy that said that admitted that it was a lie. And he just did it for like publicity, wrote a book or something. So all those people that didn't vaccinate your kids, because this guy, you know, so you can't really, you got to take everything with a grain of salt, and you know, you can't believe everything. I used to work in the medical field in pharmacy, and you know, I used to actually make chemotherapy drugs, which basically is for cancer. And what you basically do is you take an IV. An IV is just like a solution of saline, which is normal saline, 0.9%. It's isotonic, means it matches your blood. Okay, it's the same consistency, salinity as your blood. because if you have a different salinity, you can run into some problems. And they put dextrose and stuff in there, and fillers and stuff. And you know, you take then your chemotherapy drug, and the chemotherapy drugs for cancer are cytotoxic, which means they kill cells. A lot of your chemotherapy drugs will kill normal cells and cancer cells. That's why a lot of people that take treatments get very, very sick, because that is killing normal cells too. They have, you know, can make them weak and bleed and everything else. So it kills the normal cells too. So they take these chemotherapy drugs, and most of these are research and experimental. I mean, there were some drugs we would get in, cyclosporin and fluorouracil, different stuff like that, but we would get some that were real exotic, which would be like from a different country, which would be like $10,000 for a gram. I mean, it was so expensive, and we would take that and dilute it into the IV. The patient had to sign a disclaimer that it might kill him or make him very sick, and they would get it. So there's a little bit more experimentation, but if you're dying, I guess, you know, it's worth getting experimented on. You can live. So you know, they were giving all these medications and, you know, different things like that. So a lot of the scientific field is research, or its best guess, because if you go to a doctor's office, when you go to a doctor's office, you know, he can only go by your disease. He might not even have seen it. He might look in a book, or, you know, get information. I'll give you an example, and it was real, you know, a wake-up call. I went to the doctor, and my cholesterol was already low because I was taking simvastatin, which is cholesterol medicine. And I went there, and he changed my medicine to something higher. I was taking like 10 milligrams. He changed me over to 40 milligrams of atropine, which is a statin too. I think that's called, I think it's Lipitor actually, brand name, but generic one he gave me. And and he said, well, this improves your heart, it's known to be real effective, but I'm already taking simvastatin. Why would you want to change it and bring me up to, you know, 3-4 times the normal dosages I'm taking when my levels are normal? You should say, you know, eat a little bit more salad, take a little bit more krill oil. So, you know, these doctors a lot of times just read this textbook pharmacology, and pharmacology is the study of drugs, you know, and their effects on the body. So they just take this textbook pharmacology, or they see an article. Most of the time, a doctor will look in a PDR, which is a physician's desk reference, which has everything about the drugs, the dosage, side effects. They just read that. So a lot of it's not real-world knowledge that they have firsthand. So you got to be really careful. Always get to a second opinion when you go to a doctor. Always. And I'll give you an example why. I was having severe pain in the side of my abdomen. I didn't know what the hell was wrong, and also when I would urinate, I was urinating little particles and stuff. So I went over to the doctor and got checked. Well, they did a sonogram and a blood test and a urinalysis, and they said, you got a little bit of blood in your urine. Well, we don't know why, but we don't see any kidney stones or anything like that. You look like you're pretty good, and just drink a lot of water. Sent me home. I think they set me up for some kind of test, but they sent me home. Like a day after I got home, I started having the most severe side pains. I started sweating. I said, shit, I gotta go right to the hospital. So I went to the hospital, and I went to a different doctor than the one I saw when, you know, I had my sonogram. And so I went, and the doctor took me in the emergency room, checked my blood, and actually that day, the pain I was having, I started urinating some blood. I let a little bit of blood coming out of my urine. So I went ahead and went to the doctor. He checked everything, came back, sent me up for a CT scan, which is a scan which they shoot x-rays, slices of your body, and x-ray it. Comes back in and says, all right, well, you got kidney stones. I says, what? I've never had kidney stones in my life. I know I had those particles over that period of months. And I told the doctor about it, but didn't do nothing the last one. So yeah, gave me some medication and sent me home. Waited about 2 or 3 days. He said the kidney stone wasn't too big. It was already passing. It was 3/4 of the way down my urinary tract, and it killed me for about 2 days. Drink a lot of water. I got a drug called Flomax, which dilates the blood vessels and helps the stone pass. So, and I passed a 4mm stone. And I did a video on that showing you that stone. So 2 doctors, one couldn't find nothing, one found something. And the second doctor says, "What do you do with sonogram?" And that doesn't show kidney stones very good. It shows the integrity of your kidney, but doesn't show if you got a stone. So the best way is your CT scan. Sure enough, because the sonogram didn't show it. So, you know, you got to really watch it. You got to really weigh this. And you got to super be careful. I mean, you got to be so god darn careful in this world. But, you know, I wanted to bring that up. And, I've got about 58 minutes to go where I got to go, 40 miles. Hope everybody's doing good. Hey, Zeus, it's Friday, so I'm getting off from work, I hope. That goes out to my YouTuber there, Zeus. He's a cool guy. Check out his YouTube channel. He's a pretty nice guy. He's a sportsman and does some other stuff. Some neat videos. I just hope everybody's doing great. And yeah, you know, Hot Dogger 808 over there in Australia just bought I think he said he bought another Desert Eagle, which is pretty cool. You have to check it out. It's a colored one. I think it's the bronze one. He's got a bunch of videos too in there. And then you got Gun Lover, Precision Marksman. I think Precision Marksman bought a Kimber Eclipse 10mm, and those are badass guns. I'm jealous. That's a really nice looking firearm. It's very, very pretty. It's really a pretty looking gun. But I wanted to bring that up, guys. Everybody have a great day. I hope everybody's doing cool and staying out of trouble, and you know the story. But thanks a lot, and I am just getting over the bridge here. I'm on Colonial Boulevard. But this bridge really pretty much separates Fort Myers and Cape Coral. So thanks a lot. I hope everybody's doing great, and may the force be with you. But after hearing that stuff with the Zika virus, you know, and don't forget, you know, guys, I'll give you a little tip on viruses. There's a difference between virus and a bacteria, in case nobody knows. I should go do an individual video on this, but the difference between a virus and a bacteria is a virus is considered non-living. It's living and it's not living. What happens with a virus is only living when it goes into a living organism. Its genetic material gets inserted into the cell, and in the cell where it replicates itself, it takes it over. It starts making more copies of itself. After it makes so many copies of itself, the cell just explodes, and those infect other cells. Like I say, you can have a virus sitting in a dormant state in a dry, radioactive, somewhere in the heat, frozen for millions of years. Once it gets into a body, it starts working. So they consider it not living and not dead. It's just in between. It's living when it gets into an organism, dead when it's not. A bacteria is living. Okay, you know, it's got cytoplasm and plasma and cell membrane. So it's a living, dividing organism. And there's bacteria that are anaerobic and aerobic. Some require oxygen, some do not require oxygen. That's why if you step on a rusty nail and you get an anaerobic infection, you know, it doesn't need oxygen, so that infection can grow and you can get infected. So there's a few things, and you just have to weigh it. You know what I mean? When you see all this information about viruses and everything in the world, it is a complicated life cycle, and most of these viruses have. But I wanted to bring that up, and that's just my little drive-by on infectious diseases, bacteria, viruses. You know, it's tough because we are living in a world where, you know, we're globally travel a lot now. You have people from every part of the country going here and going there and going here and going there. So what's happening, actually, we're bringing more infectious diseases and things into our country because they're coming from other countries and they're coming here. So with that said, guys, I hope everybody has a great day, and thanks for tuning in.